1 in 2 South Africans believe they are unlikely to contract COVID-19. That's according to the Human Sciences Research Council survey. The HSRC conducted the poll on how South Africans are responding to lockdown and the coronavirus. In some instances, the research found that South Africans had no interaction with law enforcement officers during lockdown. Minister of Higher Education, Dr. Blade Nzimande, says it's worrying that some South Africans feel that they are not at risk of contracting the deadly virus.
It is indeed of concern that the study points to the fact that 1 in 2 people believe that they are low risk, because it tells us that we've got a lot more work to do on an ongoing basis. But it's good that research is telling that, so that we know as government that we have to intensify education. And for people to understand the point that Deputy Minister Pasha was making, that everyone is almost equally at risk. No one is more at risk.
A team of more than 200 health experts from Cuba are expected to arrive in South Africa tonight. The medical brigade, which includes epidemiologists, physicians, biotechnologists, and others, will help local officials in the fight against the spread of COVID-19. South Africa currently has over 4,300 cases of the novel coronavirus, with 86 people succumbing to the disease. To look at the significance of this and reflect on the importance of Cuba-South Africa relations, we're joined now by political analyst Professor Somadoda Fikeni. Professor Fikeni, very good evening to you, and thank you so much for speaking to us. Now, I want to talk about the ideological similarities, or at least commonalities, and social development very much at the center of that. Is this why not only is it important, but a coup for us in the sense that we have people working with us, helping us, who understand our goal?
Certainly, I do think that we ought to start by looking at the history of South Africa and Cuba's relationship. It starts with Cuba supporting the anti-apartheid liberation struggle. And it went on to be the one that was quite decisive in the independence of Namibia after the Battle of Cuito-Cuanavale, where Angolans and the Cubans won. And since then, Cuba has been supporting our social development programs. It's not much the ideology between the ANC and Cuba as such, but mainly the kind of solidarity that you have seen. You would have a lot more commonalities in terms of ideology between the South African Communist Party and the Cuban Communist Party. But more important, though, is that the ruling tripartite alliance in South Africa has had a very long relationship with Cuba, including training of health officials.
And just given what is happening around the coronavirus and the global order, what we've seen is the very important equipment and tools that we need as a continent to fight the coronavirus. A lot of them have been usurped by countries who have financial muscle. There was a time that we couldn't find masks, we can't find ventilators, because they have been usurped, as I said, by countries who have the financial muscle. So Cuba's role in the diplomatic or medical diplomatic arena, how much does that help us, them coming here to help fight the coronavirus?
The most important factor there is the human resource element, where you have the Cuban doctors, the Cuban health professionals, because Cuba globally, even by its own detractors, is recognized to have one of the best health systems in the world. And that in itself, I think, will be key. South Africa may try to provide other equipments, and they may have the space, but when we do reach the apex of this particular pandemic, maybe in winter, we are going to be stretched so thin. That's why even the army medical practitioners are coming to assist. Therefore, the coming in of Cubans comes at the right time.
Now, I want to talk about foreign policy. Obviously, Cuba has always been very willing to assist us with personnel, such as we've seen medical experts. Is South Africa placed in any difficult position? It's working relationship with the United States. I won't call it close, but certainly we do have ties that bind us.
Certainly, South Africa has had a far more pragmatic approach and a more independent one of not wanting to be pulled either to the east or to the west. It has had relationships, some of them traditional and historical, but at the same time, its solidarity relationship was stated even by Nelson Mandela when he was visiting USA after his release, that the countries that had supported South Africa's liberation and some of the fellow liberation organizations such as the PLO and Cuba, Fidel Castro, were far more important for moral, ethical, and also historical reasons. That's why this relationship has endured. And as such, you'll find that Americans or Europeans do accept by now that we have such a special relationship, and it doesn't often stand on the way. Of course, South Africa has stated very clearly that it's calling for the end of the embargo against the Cubans.
And speaking about that visit, when former President Mandela visited Cuba in 1991, he stated that we come here with a great sense of the great debt that is owed the people of Cuba. And we were reciprocal in sending our medical students to Cuba to learn. So just what exactly has Cuba taught our medics? And just looking at the expertise that they're bringing here, what are we going to get? What are we benefiting?
Well, a lot, but one thing that the Cubans have excelled in is preventive medicine rather than the curative medicine, and also the public health education. And that is something that our medical schools and our health system is still grappling with, because we get sick first, and that's when we start addressing those when it is very expensive. And the second part has been the community outreach. When Cuban doctors come, they do not mind going to the villages. They do not mind going to the townships or the deepest of community remote areas. So that in itself to us is still a challenge in terms of conscientizing people to know that when they have the highest qualifications, it's quite an honor to service the most vulnerable in the most remote areas, rather than us stampeding into the suburbs or into the cities where there are conveniences for ourselves.
And just further than that, just looking at South Africa's soft power, which some would say has been a result of the close relations with Cuba coming out of this crisis and into the multilateral arena, how is it going to improve our standing in those circles?
Well, in many ways, remember that Cuba's solidarity has been shown in Italy. It has been shown in Russia after the Chernobyl nuclear accident. So it is most likely going to strengthen our role in the South or Southern nations who are still trying to find space in the geopolitical arrangement in the world. So standing by Cuba also shows a country that has principle, that doesn't say, now that you have assisted us as Cuba, it is over, we are going to chart our own path. Just a matter of principle.
Thank you so much for speaking to us, political analyst Professor Somadoda Fikeni.